Good morning, everyone, and welcome. We will get started in just a moment. We're going to let everybody in from the waiting room and get going. Good morning, good morning. Well, good morning to everyone. I'll go ahead and kick us off. My name is Andrea Sobrato, Senior Associate Director at CFPIC. Welcome to our first session in our year-long series designed to support County AB 2083 teams as they resource effective cross-system care continuums for children, youth, and families. It is with deep respect and acknowledgement of the common ground we stand on together, the shared commitment to every community's children and youth, and that each would be surrounded by a loving, caring family, well supported within a robust and trauma-informed system of care. Last year, CFPIC and the System of Care Work Group hosted 4 regional AB 2083 convenings, and many of you were there. At the end of the convenings, we surveyed everyone. The number one request for future convenings was for more opportunities to explore concrete strategies that support children and youth with high acuity or complex care needs. And according to the survey, the number one challenge was the silos and programmatic barriers between systems that made necessary collaboration very difficult. Specifically, you said you'd like to hear more about how to tackle fiscal challenges, resource challenges, and strategies to maximize revenue. Lots of responders asked for more focus on sustaining interventions that work. So over the last year, we endeavored to take on a series of convenings that would provide a foundation for better understanding and optimizing the fiscal landscape in each county from the perspective of behavioral health, county social services, education, regional centers, probation, and recently CalAIM. While program folks might be reaching and striving to break down barriers between systems, if each other's fiscal teams aren't at the table, we will only get so far. And that might be the North Star for this whole series. So today's convening will focus on the importance of authentic relationships between program and fiscal, and setting up both relational and organizational pathways for shared fiscal planning and collaboration. We hope this first session inspires conversation and that you might consider inviting any of your partners who aren't here today to our future sessions. And as a part of this series, we are offering technical assistance to County AB 2083 teams to further support your cross-system program and fiscal collaboration. We're going to drop a couple of items into chat right now, the PowerPoint deck that we'll be using today, and actually the flyer that describes the available TA after we wrap today. Please consider this available support as you think about next steps for your county team after today's session. And as we get started, I'd love to find out who is here today. So let's turn to a quick poll to find out.
All right, good morning, everyone. I'm going to launch a poll. Please take a few seconds to fill this out. All right, let's give it a few more seconds. All right. And here are the results.
Oh, great. Oh, it's so nice. We've got representation from all of our key system of care partners, child welfare, behavioral health, regional centers, probation, education, and it looks like a lot of folks here represent their county teams. That is great to see. Well, welcome. I'd like to take a moment to thank our incredible work group for their support in designing the content for today and the overall layout of the cascading topics for us to focus on this next year. But if I put all of their individual names on a slide, it would be too long. We started with our CFPIC consultant team and added the strong support of our state AB 2083 Joint Resolution Team, which carries the legislative responsibility for ensuring and supporting local AB 2083 implementation. We also had representation from all the associations or designees which represent key local members, and those are the County Welfare Directors Association, County Behavioral Health Directors Association, Chief Probation Officers of California, and the Association for Regional Center Agencies. We've also had the benefit of some very highly regarded senior county fiscal subject matter experts who will stay on board this entire series to ensure that the fiscal perspective is robust as we talk about programs and service delivery over the next year. We'll hand the presentation over to them in just a few minutes. And now, CFPIC's Capacity Building and System Integration Program Director, Laura Kwiswicki, will continue setting the stage for today by sharing about the funding that has allowed us to design a 3-year-long system of care convening series, complete with follow-up technical assistance between each session. Laura?
Thank you, Andrea, for describing the vision of this work. And I'd like to talk a little bit about the CFPIC Complex Care Grant that was funded by CWS Realignment. In partnership with CWDA, the Complex Care Grant provides technical assistance and implementation support to county system of care teams. The central aim of the grant funding is to strengthen the continuum of care for children and youth, especially those with complex needs who are involved in multiple systems. The grant will continue to support county teams through 2027. We know there are several important funding streams in play. For example, capacity building funds, child-specific funds, and the CFPIC Complex Care Grant. It's important to understand that these are distinct but serve similar purposes. And thanks to CWDA and child welfare leadership, we have a valuable opportunity to align these efforts and rethink how we show up for our most complex youth. While the funding may originate from child welfare, the success of this effort depends on all of us bringing our full expertise and creativity to the table. No matter which agency or discipline we're from, we all face similar challenges, and these children and youth aren't just navigating one system, they're navigating many, often all at the same time. And the reality is no single system can meet these needs alone. While the CFPIC Complex Care Grant prioritizes developing downstream interventions for youth requiring immediate attention, our aim is to help push county teams approaches upstream whenever possible. Grant success will not only ensure that youth involved in multiple systems receive the support they need, but it will also enhance the capacity of the interagency teams to support all children and youth. These convenings aren't just meetings, they're spaces for shared visioning, cross-system problem solving, and above all, collective action. The objectives of the Equipping series focus on the core system of care work, building coordinated, comprehensive, and trauma-informed systems, including alignment of fiscal strategies. Each child-serving system operates within its own set of funding streams and rules, which can either enable or limit collaboration. Understanding the core fiscal principles is essential to working across systems. This is our shared starting point to build a common understanding of the fiscal and system landscape that we're all working within. This foundation is essential as we move into key programmatic opportunities. We'll highlight best practices and real examples of counties successfully using cross-system funding, not as a one-all-fits-all model, but inspiration for learning. The series will emphasize shared learning by identifying and lifting up what's working well across counties, fostering transparency, and building upon strengths to improve outcomes for children and youth. And through technical assistance, we'll support counties to strengthen local services for youth with complex needs. Our goal with Fiscal Essentials 101 and 101B is to lay a foundation, not to make anyone a fiscal expert, but to make sure that we're all speaking the same language when it comes to funding and strategy. These sessions are really about building shared understanding and stronger collaboration between programs, fiscal teams, and leadership. The survey results many of you provided back in December helped us zero in on what matters most. Today, we're starting with the most essential part of any system, relationships and partnerships. These are the backbone of effective programs and successful funding strategies. We'll go deeper in 101B, looking at how specific funding streams work and how we can start applying that understanding in more strategic ways. Our goal is to continue hosting sessions each quarter, with topics that may shift based on evolving local guidance and emerging needs. As a result, some of this session content may change over time. And lastly, we're especially honored to have such an incredible group of current and former county leaders joining us today to share their knowledge and guide us through the rest of the presentation. We have Robert Manchia, Chief Financial Officer, San Mateo County; Monica Bentley, Retired Director of Finance, Department of Public Social Services, Riverside County; Artie Apostol, Director of Finance, San Mateo County; Joe Hallett, Behavioral Health Director, Glenn County; and Melissa Chavez, Chief of Administration and Fiscal Services, Department of Child and Family Adult Services, Sacramento County. Thank you all so much for being here and your continued partnership. And with that, Monica, I will turn it over to you.
Well, thank you, Laura, and welcome everyone to our session today. We hope that we have a very exciting agenda for you today. In the forefront of our discussions, we will be focusing on relationships and their importance in everything that we do. I know that fiscal topics technically aren't exciting, and most people become overwhelmed. But today, our fiscal team is going to focus on some foundational topics. We hope to really talk about relationships and how foundational they are to the success of any endeavor, but especially in the complex systems that we operate in every day. We want to highlight how important it is for fiscal and programs to talk and discuss and get together to choose the path forward for any services that will be delivered. And we also want to highlight how important it is for different agencies to work closely together and be open to new opportunities and ways of thinking. We'll review some past models that you should be familiar with, and we hope that you'll be able to learn from them and how to operate in those types of constructs going forward. And we also want to help everyone understand that fiscally, there could be some really good consequences, but there's also some unintended consequences if decisions and impacts aren't carefully weighed and made together with program and fiscal together. So our agenda today will start with relationships, and we're hoping to spark some thoughts on how to strengthen and engage what might already exist. We'll also touch on some very high-level fiscal topics, such as claiming, and what types of things are needed to be taken into consideration when you're deciding to utilize some funding sources and the impacts that those can have on claiming and the budget and revenue sources that you have. We'll touch on a couple of scenarios in claiming, but we'll do that only to highlight the importance of making sure that discussions happen prior to those decisions being made. And then, of course, we'll come back to relationships to bring it all together. So with that, I'm going to turn it over now to Robert, and he's going to start us off with some really important discussions.
So, hi, everyone. I think the first question we need to ask is, why are we here? And I think there's really a basic answer. There's 36 of us or almost 40 of us in this room, and we're all talking about it's because we care. It really is, or you wouldn't be here. And that caring is what we really want to get through, because that caring becomes the conversation that we start with. To do this, and what we need to do here is we need to look at all of our systems and forge better understanding, capacity building, and implementation for each of these systems that we have in place, because none of us understand the entirety. And we need to do it together. We need to do it together so that we can really bring different resources and different pieces of a puzzle to a table that we can then discuss. A lot of times we always stop and say, it's because the funding doesn't allow us to is why we can't move forward. And I challenge that. I challenge that because sometimes it's not only about the restricted funding source, or maybe it's about the wording. And how do we get these words to become something that we can utilize to really move the funding forward to get the things done that we need to get done? I'm going to give you a little bit of information that we kind of dug up from the pediatrics publication. And it's really in regards to Medicaid because we're all dealing in this Medicaid space today. So Medicaid usage by foster care, children in foster care account for a disproportionate high share of Medicaid expenditures when compared to other children in the Medicaid programs. For example, although children in foster care represent only 3.7% of the national children enrolled in Medicaid, they account for 12.3% of the total expenditures and 25 to 41% of Medicaid mental health expenses. That really is kind of a telling sign of why we're all here, especially since these are the kids that we're all dealing with in many different ways. About the finances and where we're here. Here's some information I found from the Obama White House and a report on childhood investment. $1 spent on a child today can have a significant impact on their future, potentially resulting in a return of several dollars down the line. Studies suggest that high-quality early child care or early childhood programs can yield returns of $4 to $9 for every dollar invested. The return can be attributed to various factors, including increasing earnings, reduced crime, and a lower healthcare cost. The things that you see on the slide in front of you are just explanations of why we want to spend these dollars and why we want to put these financial systems in place. Because if we can support the children today, and we all know this already, if we can support the children today, the better outcomes we're all going to have in the future. And that really is what this is all about. Now I'm going to ask you to do something a little funny and probably something that will make you a little uncomfortable. But I'm going to ask you to close your eyes for a moment and just picture the words of what I'm saying in your head while your eyes are closed. Okay? So every child's needs are met in a cohesive system of care. Social workers graduate by the dozens, and everything resides in one system of choice. Visualize the ease and efficiency in this world where barriers are removed and coordination is seamless. Now go ahead and open your eyes. It really is about reflecting on the things that we just kind of thought about, the things that you kind of saw when those things are there. And we can maybe not achieve all of them, and some of them are completely out of our control, but how can we make this a more interesting venture for everyone? How can we really begin to put the pieces of the puzzle together so that it becomes one cohesive picture? What you're going to see throughout the day is a few different things that may cause some thought or may cause a couple of the pieces of the puzzle to kind of come apart, but we can always get them back together. Today, we're going to start by asking, or what tools and systems or processes are already in place, and what do you have that already exists? We're going to show you some of those. As we move through the presentation, we'll be returning to the idea of what can we leverage, what can we begin to do, how to recognize and leverage the strengths and resources you all already have. But before we can truly move forward, we believe it all has to start with the foundation of relationships. So let's talk a little bit about relationships. Relationships are really important, right? Let's take a moment and think about the relationships that we have today. In the context of programs, it's interesting to observe that whether you're in business or in government, how communication and relationships often take a back seat to the day-to-day work we have to do. Yet, they're often the most powerful tools that we have for driving meaningful progress. Think of it like a forest or a garden. The soil is the foundation of our programs. The trees and the flowers represent the families and the children that we serve. And the elements that sustain life, sunlight, water, air, are like the funding and the resources that support the whole system. Each piece needs to work together in harmony for the environment to truly thrive. I know it's a bit of a weird analogy and unusual, but sometimes stepping outside of the usual frame of reference and the usual guidance that we have or the silos that we have in front of us that Andrea talked about allows us or gives us a little bit more clear reference of what it is that we're kind of trying to see. And really, the conversation is about seeing. The conversation is about having those things moving forward, which generates the relationship. To make the vision behind AB 2083 a reality, relationships must be front and center. Trust isn't one-time achievement. It's something that we have to build and maintain every single day. Next slide. So here, what you're beginning to see are what I was talking about a little earlier. These are programs that many of us have. And what you see within these boxes is that many of us are already having communication and having relationships that are built. My question is how do we forge these relationships into the larger context of a program rather than being more individualized in these little programs that are part of the whole? When you look at the RAP program, you have behavioral health, you have local schools and education, you have probation, you have child welfare, and some of you may even have regional centers involved in it. When you look at integrated core practice models, it already has everyone that we just talked about in that same source. Linkages is probably one of the oldest means of really beginning to look at how funding can actually be used to be able to braid so that you can get child welfare families into a CalWORKS program and some of the costs paid out of CalWORKS rather than just driving all the costs out of Children and Family Services. These are all different models where we use different pieces of funding, different resources to kind of get us to that next step. Our challenge is to make this the conversation that continues to move on and these relationships part of everyday life, rather than just being part of that simplicity of that one child that's within the system or those 10 or 20 kids that live within these programs. How do we expand this to get a little better? From here, I'm going to turn it over to Monica to bring us into a little bit more of the claiming and financial realm.
All right, thank you, Robert. So before we actually go into the claiming part, as Robert talked about kind of stepping outside of your box that you operate in today, that is all of us have operated in, I want to stretch your thought process about this whole trees, flowers thing as it relates to relationships and how we do things. So if we look at cross-sector work kind of as a forest, what would that look like? And so we're going to suggest today that maybe the tree would be the child and the family, and each tree in the forest represents that child or family that we are serving, that we're looking at to help grow and be strong and thrive in their environment. The next thing that we might point to are the roots, which would be your foundational support systems. And what are those? They could be housing, education, employment, healthcare. Each one of those roots brings nourishment to that tree, helps it to be strong, helps it to grow. And where do they get what they're bringing to, the tree itself? They get that from the soil. So the soil could represent the community and the resources and how, in the broader societal context, it's enriching those roots with nutrients. And what are those? Those could be financial support. Those could be cultural values. They could be policy frameworks. All of those come together to sustain the tree. Now, in a forest, we call it a forest because there's more than one tree, right? So if we have multiple trees in the forest and they're all thriving and growing and they're strong, they kind of come together and create what's called the canopy, which represents the collaborative outcomes of everything coming together. It's healthy children, it's stable families, it's resilient communities. And together, they help each other and they shade each other and they provide shelter for each other as they continue to go through life. And they reflect the safety and the stability created through those collective efforts. All of that creates an ecosystem where trees are able to thrive and coexist and interact with each other, that there's cross-sector work when systems like child welfare and education, healthcare, all work together. And then that brings together like an invisible linkage beneath the surface where you've got a system of fungi that connects the tree roots and represents data sharing, communication, joint planning. All of that is sometimes invisible, but they're all vital for exchanging those resources and strengthening that forest, that ecosystem, so that it can thrive and grow. So as we go through the rest of the presentation, kind of keep some of that in mind. Think about how trees and plants need what they need to be able to be strong and grow, so that we can apply that into our work concepts. So we're going to get into some claiming things. The world of fiscal, no matter where you're from, there's complexities to the claiming side of all of our programs and all of our funding sources. And of course, there's overarching regulations that we all must be aware of to ensure that we are remaining within what is allowable under the funding sources that we access. This webinar is not long enough to cover every partner in the system of care. So for just this webinar, we're going to mainly focus just on social services and behavioral health to use as examples of what happens, what could happen, what conversations need to happen, and things that need to be taken into consideration to just be able to lay that foundation and start all those discussions. So let's start with social services. Of course, social services has a lot of regulations and funding sources. There's one big claim called the CEC, or the county expense claim. And there's a lot of factors that come into play. We get CFLs and ACLs, so county fiscal letters and all county letters, that come to the departments and the counties to describe what a program looks like, what's allowable to be claimed, how it's supposed to be run, what the intentions of that program are, and how the funding will work together. If there's match involved, all of those things are in those letters. But even higher than that would be the 2 CFR 225, which all of us have to take into consideration. And those are the federal regulations that dictate kind of from an overarching perspective, what is allowable, what we can do, what things are to be taken into consideration. And then there's the county cost allocation plan, which is the plan that's been submitted to establish how things are allocated into a claim with a lot of programs in it. It's just not child welfare. There's CalWorks, there's Medi-Cal, there's CalFresh, there's Adult Protective Services, there's IHSS, there's foster care admin. All of these things are in there. And they all have to be, when costs are put in there, they have to be allocated to these programs based on that allocation plan that's been approved. And the funding sources related just more in this child welfare, so we're going to focus on that. Of course, you have realignment, which is both 1991 and 2011. You have the Title 4E, which is the federal funding that actually establishes child welfare as a program. And so in certain situations, that's able to be drawn down. And the state has used TANF funding in child welfare in some instances. So there's a lot of things that are moving and things that have to be considered when doing a claim. But the admin claim, or the county expense claim, isn't the only claim in social services that has to be taken into consideration. There's also the assistance claims. And that's like two sides of the tree for social services. They have to look at both sides of what's happening to be able to manage all the funding that they do get. Your administrative claim is really just for claiming for the costs associated with all your workers, whether it be social workers, eligibility workers, your office assistant staff, your director. All of those things are in the admin claim, as well as the costs for your office supplies and various contracts that we have to administer services, any buildings and cars, travel. All of that is in the admin claim and needs to be carefully reviewed and make sure is following all the rules that we have. And on the assistance claim, that's really for when we're paying costs directly to a client. For example, when we're issuing cash assistance for a client out of CalWORKs cash assistance, that would be in the assistance claim because that's a benefit that goes straight to the client. And in child welfare, that would be our foster care placement costs, where when we place a child in either a STRTP or an FFA or family home setting, as an example, those costs are collected and claimed in the assistance claim. So let's look at the CEC claiming flow for just a little bit. We talked about all those costs where all your admin costs, your personnel costs, your contracted services, all of those are gathered at the very beginning and become the basis of putting together that claim that is done on a quarterly basis. The next thing that happened is the cost drivers that are going to drive those costs to the program. Remember, I talked about we've got a bunch of programs in that admin claim, and there needs to be a way that those get to those programs in the allocation methodology. The main cost driver in the CEC are time studies that are done by the workers that are working with all the clients in those programs. So when social workers are visiting families at their homes, when eligibility workers are determining eligibility, they're time studying to those programs while they're doing that work. And those time study hours are what determine how much of those costs go to each one of those programs. And all of that is done inside of the CEC to then allocate to the programs and match against allocations. We actually get allocations for many of our programs still. And so in Fiscal at Social Services, we have to manage against those allocations and ensure that the costs that get allocated to those programs don't overrun the allocations. And once all of that is done, we submit those claims, and that's when the revenue is provided in social services for the admin type functions. Similarly, is the assistance claim, and there's a flow to that too. I talked about in foster care that the costs associated that go into the assistance claim are related to placement costs in the FFAs or the STRTPs. Those are called placement types. And those are important because for each placement type, the state has approved rates that we're able to claim for when we place that child in one of those settings. That comes together and creates the costs that are going to go into the assistance claim, which is submitted on a monthly basis, different from the CEC, which is quarterly. But then you also have what are called aid codes. When a child comes into our system and we're going to place them, they go through an eligibility process that determines whether or not they're eligible to draw down any federal funding. And that eligibility process puts them in a variety of aid codes that are included in the assistance claim so that when those costs come in based on that child, it determines how much federal funding there is, how much match needs to be provided, and all of that happens in what's called the CA 800 claim. And that's what the assistance claim is. So as I've tried to explain, social services admin claiming, it utilizes caseworker time study codes to allocate costs across multiple programs in a very fair and equitable methodology that's been approved by the federal government. And similarly, the assistance claim is based on eligibility requirement of the recipient. So that's kind of how claiming in a claim works, where the structure of the claim dictates how what you're doing is going to be funded. We're going to contrast that now to look at direct claiming to a funding source. In behavioral health, claiming is more focused on direct claiming to just a funding source. In our analogy of plants, where social services is like a tree in the pictures I was showing, behavioral health, we're going to make it look more like a flowering bush, where the services are related to different types of flowers. And as you're picking those services, you're kind of building a bouquet. for the client that you are serving. So to get more in depth to that, I'm going to pass it over to Joe, and he's going to go over more of the behavioral health structure with you.
Thank you, Monica. So yeah, this is going to be a very, very high level, brief overview of behavioral health funding. Really, we could get in depth on any of these subjects all day long, but just wanted to show the contrast and some of the ins and outs of behavioral health funding, because part of our strategy in complex care is we're looking at redundant contracts, or could we add revenue with Medi-Cal or ECM or these other things that to try to bring more revenue sources in and try to reduce any overlapping service or things like that. So just wanted to lay some of the groundwork using this analogy of we've gone from the forest and the trees into the behavioral health as the flowers and the bush and a bouquet of services that you might pick in the analogy we've got here. But so briefly, this is just generally in California how behavioral health services are funded. It's made up entirely. Most of what we do is claiming to Medi-Cal for either specialty mental health or drug Medi-Cal ODS type services. And so that includes a big chunk of federal financial participation as match. But what we usually have to do is come up with local or state dollars for a local match to those services. And that's kind of based on a rate determined annually by the federal government too, and CMS with Medicaid, but locally, like it differentiates too how much, like some states have a 50/50. We have expanded Medicaid where feds put in up to 90% of a claim and we match it with 10% local dollars. So that kind of varies and all over the place. But the other types of funding are things we might match with, like 91 and 2011 realignment, which other social services and probation and other folks get some of those funds too. There's mental health and SUDS state general fund, which are kind of statewide general initiatives usually. Um, some other counties get other mental health funds, like if they applied for a grant or might have a local tax initiative or get some general fund from the county or whatever the case might be, that those are covered in the other mental health funds. There's a federal substance abuse prevention and treatment block grant, sub-G as it's known, and that's for treatment and prevention services outside of Medi-Cal coverage. And then the big one that we're going through more recently is BHSA listed there. That's Behavioral Health Services Act. It was formerly Mental Health Services Act, MHSA, and that's a 1% tax on anyone who makes over a million in California, designed to be, well, it was designed to be heavy with local stakeholder input and kind of flexible programming. With BHSA, some of that programming is shifting out of behavioral health, where some of the prevention work is actually going back to the California Department of Public Health. So anything, it's looking like anything that's kind of population health based. So what we would have done in behavioral health with prevention or stigma reduction and those kinds of things won't be part of the array of behavioral health in counties moving forward with Prop 1. But um, with a lot of that, and then it's a pre-prescribed buckets of funding that's housing, full service partners, and behavioral health services in general. So a little bit, there are waivers and things counties can ask for depending on your size and need, and some flexibility of funding. But the idea is to target those areas, which a lot of these funds are used as match for county networks and things. So it could actually be a strain on some networks moving forward, not that narrative of adding any particular funding to counties. It's just kind of reorganizing it. And then, of course, counties through that process are going to have to put all of their funding sources into an annual plan and get stakeholder feedback on that. So this is just kind of a general snapshot of how behavioral health is funded in California. So when we look at, I spoke to a little earlier, but some of the complex care strategies, adding revenue, pursuing Medi-Cal is a massive one. So just to make folks aware, if you're not, that behavioral health, specialty mental health, or drug Medi-Cal services, drug Medi-Cal ODS are through contracts with the county. California operates under what's called a 1915B waiver for Medicaid, which that's a freedom of choice in providers. So we waive that in California to where these kinds of providers are either county direct providers or county contracted providers. So that's one piece of the puzzle here. There is some state plan drug Medi-Cal providers that can be contracted directly with the state, although most counties have kind of become a network of their own in managing these specialty or SUD networks in their county. So it requires certification of as a Medi-Cal specialty mental health or SUD provider. There's all kinds of credentialing standards, license standards, scope of practice, and so it does take some careful thought and planning and what type of service and where it's provided. Because essentially we're claiming to health insurance. Medi-Cal is health insurance, right? So it comes with its own set of rules with our particular carve out. There are different levels of care with behavioral health and Medi-Cal. So counties have what's called moderate to severe services on the mental health side. Um, and it's based on a set of criteria, impairments and things like that that might be associated with a mental health condition or SUD condition on the SUD side. But our managed care partners have what's called non-specialty mental health, which would be more of the mild to moderate services. And they also cover ECM and those other things, which I'll get into in just a little bit here. And then, so we've gone actually, behavioral health used to be a system where we settle to cost annually with the state. That's one of the things CalAIM changed for behavioral health is now we have rates determined by the state and have to basically make sure we're claiming enough that those rates cover our costs. So admin costs and other things. I mean, there's different things we can claim to, like QI/UR claims and things like that that are more administrative, but generally more often now we have to ensure rates are, that we're maybe one area that's producing a high volume of services might cover an area that's more expensive and not producing, like outpatient versus crisis. So planning around that too. Um, the other thing is we've noted, like with some of the feedback from some of the CalAIM 301 trainings and things like that, where people talk about placements. This kind of model creates a little bit of friction with placements where, maybe a smaller county doesn't get the same rate a larger county does, but that contract provider, of course, is going to want the larger rate they can get. And so that can create friction or stall placements or even make some counties have to come up with a rate beyond what they get reimbursed to try to place youth and things like that. So just some of the more interesting takes on it. But that also speaks to I've heard the narrative, CalAIM's adding funding. It didn't add any funding to behavioral health. It just made these kinds of changes for these specific programs. So claims, like I mentioned earlier, they're a combination of local match and federal funds. They've got to be for a particular service type in a person's scope of practice. Um, like I said, there a lot of with expanded Medi-Cal, there's a 90-10 split. A lot of states have a 50-50. There's people have different coverage based on aid codes and shares of costs. So all of that goes into the complexity of trying to plan out costs or, you know, thinking, oh, it's simple to add revenue. There's other hidden costs that go into it when planning these things out. And of course, being a Medi-Cal provider makes one subject to audits and reviews by DHCS, or if you're a contractor by your county behavioral health department. And so there is a lot of additional administrative strain to opt into these kinds of services. So this is more about our managed care plan. In those cases, like I said earlier, non-specialty mental health or SUD, enhanced care management and community supports are under the purview of managed care Medi-Cal plans. And so any of those types of providers are a direct contract with the managed care plan. They have a different set of access criteria and medical necessity standards than specialty mental health or drug Medi-Cal does. And then the rates are negotiated between the plan and their providers, not like a set rate like county is with behavioral health. And then any audits and reviews are conducted with whatever the managed care plan standards are on that side of the house. So sometimes we lump in these discussions recently, I've heard ECM lumped in as behavioral health or community supports. They're not particularly they're not particularly behavioral health services, but they can be a focus, a population of focus, like it's a mental health concerns or SUD concerns can be a population of focus for ECM. All right. So with that, I'm going to pass it over to Melissa to talk about our other partners in the system of care.
Thanks, Joe. So we just kind of briefly and really quickly and high level went into the social services and behavioral health. Let's zoom out even further and look at some of our other critical partners in the broader system of care. So first, we're going to focus on education. So education, next slide, Monica, operates within a highly structured funding and accountability system. Specifically, the Local Control Funding Formula, LCFF, provides the majority of these flexible educational dollars. But those funds are guided by each district's Local Control and Accountability Plan, or LCAP. These plans really focus on improving academic outcomes. So trauma, system involvement, unless it directly impacts the educational performance of the youth, those factors sometimes don't always rise to the level of district prioritization. There can be important touch points, though, for the cross-system collaboration, specifically with some Medi-Cal administrative activities. That does allow schools to draw down some federal reimbursement, specifically for outreach and some care coordination related to Medi-Cal services. And then some of you may be familiar with the IDEA, so special education supports under the Individuals with Disabilities Education Act. That specifically provides services to students through the IEPs, or individualized education programs. But some of the challenges could be like if a youth isn't identified through an IEP or linked to a specific title program, schools often lack the mandate and therefore the funding to sometimes address behavioral health or placement instability. So next, let's take a brief high-level look at our regional centers. They operate under the Lanterman Developmental Disability Services Act, which makes them really distinct from other service systems. This funding is almost entirely state-based, and they send their resources through the Purchase of Services, or POS model. Some great things about this model is that it allows for highly individualized supports. Some examples could be one-on-one aids, behavioral interventions, and residential placements that are often difficult to fund through other means. But that flexibility of the funding comes with a key limitation. The eligibility is very narrowly defined. To qualify, a youth must have a diagnosed developmental disability that originates before age 18, and it also has to meet the statutory criteria under the Lanterman Act. Regional centers don't usually bill Medi-Cal directly for services, but they do work in parallel with systems that do. This overlapping landscape can definitely create confusion around funding responsibility, and particularly when a youth's needs span these multiple domains. Specifically, these services are guided by the IPP, or Individual Program Plan, and the cross-system coordination that we're all talking about here is really essential to avoid those gaps in care. And then lastly, I want to mention probation. So probation is their funding framework is really grounded in public safety, not necessarily human services, which again makes it both distinct and sometimes challenging to align with systems focused on behavioral health or education, or what we oftentimes refer to as family-centered care. Probation has two major state funding streams: the Juvenile Justice Crime Prevention Act and the Youthful Offender Block Grant. They are really designed to support youth rehabilitation. Some examples that these funds might go toward are evening reporting centers, reentry programs that aim to reduce recidivism. But I also want to bring up that probation can access Title IV-E funding, especially for youth around their placements and those with intensive behavioral health needs. So just wanted to mention these three partners. This is a very drop in the bucket, high level overview of what makes up our system of care. We're going to get into some more specifics in the upcoming series. And so just reiterating, this is really where that multidisciplinary teaming becomes critical, right? We really need both program and fiscal partners at the table to ensure that the funding follows the youth, not necessarily the system. And by aligning these streams early, it can really prevent service interruptions and support better outcomes. So before we move into a deeper look at the systems and where they specifically intersect, we want to give a moment to reflect and connect with others. So this breakout session that we're gonna, in just a minute, I'll turn it over to Andrea. We are going to, it's designed to kind of spark practical, regional, specific dialogue. And we're gonna, Peter just dropped in the chat the breakout session guide, and we'll put the questions in there too. It's gonna follow you to your room, so you'll be able to reference that. And then we'll come back together after this to explore how these overlapping systems can either create redundancy or with the right planning really build synergy. Andrea.
Great. So, yep, Peter dropped the breakout guide into the chat, but in each of the breakout rooms, you will have facilitators. So don't worry about, grabbing that and really concentrating on what's written on that guide. We'll handle facilitation. We have 4 breakout options for you to select from. They're going to be organized by regions of California. So Southern, Central, Bay, and Northern. So we're going to ask you to select, if you go down to the breakout button on your Zoom screen, just click on breakouts, and then you'll self-select into one of the regions that you most affiliate with. And if you work statewide, feel free to go to any region that you'd like. We will reconvene in about 10 minutes. See you in breakouts.
Thank you guys so much for taking that time in the breakout session. Can I get any volunteers to maybe just share what they discussed or anything that resonated from that?
Yeah, I'll go first. Thank you so much. It was a great breakout. I think our breakout surfaced over some of the big theme areas. Opportunities to enhance collaboration would be to have fiscal folks from every system as permanent members of the ILT or part of the advisory team. We've talked about this phenomenon, like when we need fiscal, we leave the conversation and we go ask, but they're not at the table from the beginning. And then another challenge is in structure, the membership. Sometimes each agency just sends one person to kind of system of care conversation, and the one person, the turnover rate we're sort of always orienting new folks. And so I think that membership piece was big for us, that we had to build in structure and process to make sure that fiscal people were at the table, and that the work on system of care spanned outside of just the one like designee from the system. So that's what we talked about.
Awesome. Thanks for that. Corey.
Hi there. You know what? We were meeting as a Northern group, and it was fascinating to really hear the numbers of barriers. And I know that we want our, we tend to want to get into focusing on the opportunities, but sometimes the reality is we're hitting a barrier. Some of the barriers that were talked about had to do with trust. And one that I really appreciated hearing about was sometimes the goals are not the same goals. So if your core goal as one of the siloed entities, which by the way, the siloing of our programs was really called out as well, that we could end up finding ourselves going in multiple directions. So we did start building some ideas into where we can go in future sessions. And so thank you so much for the Northern group for your input on that.
Melissa, I can go next for the Southern group.
Awesome.
So some of the opportunities that came up during our breakout was developing shared tools. We talked about like a crosswalk of funding sources, a roadmap for cross-system collaboration, and like how do we map out some of those existing resources that are available across the different partners. And then we talked about focusing, on the core needs of the individual child and how to get that voice at the center when we're discussing planning for that specific youth. And then also integrating fiscal and program leaders, like really similar to what Andrea said, making sure that you have the fiscal and program people together, discussing and working through some of those barriers and opportunities. And then just a couple of worries that came up were around, the complexity and eligibility of all of the different programs that the different partners have, and then making sure, like, how do you really develop a strong meeting with those partners. And sometimes you have missing voices at the table. For example, maybe you have lived experts there, but they don't understand some of the fiscal discussions happening. And so how do you really sort of work that through so that it's a really collaborative meeting for all of the partners that are there?
Thanks for that, Laura. Sounds like some great dialogue.
Melissa, really quick from Bay Area, we had a small but mighty group. Thanks, RD, for joining, and Anna from Contra Costa Child and Family Services. We went down a bit of an intentional rabbit hole around the comprehensive prevention plan funding, where this is super timely, right? Because that most recent state guidance that came out under letter 25-12, I think, has that payer of last resort protocol guidance that is going to require a template between the agencies locally to figure out how the Medicaid dollars get spent and how the 4E monies get spent underneath the FFPSA Part 1. So we pondered on that a little bit. And then we also talked strategy, and just in terms of Contra Costa does have some ongoing consultancy relative to their 2083 build. And one of their priorities that they just identified just 6 weeks ago was exploring this whole idea of fiscal revenue maximization underneath their 2083 work. And so we thought, this is great, because now we have a pool of experts here assembled today that are presenting, and that we could tap your wisdom to help Contra Costa begin to formulate some analysis of whether they're maximizing all their 4E and Medicaid dollars for their kids. So yeah, thanks.
That's awesome and very timely. Okay, if nobody else has anything to share, I'm going to move on. Really want to say thank you for leaning into those conversations. That's an important piece of the series, is really robust dialogue, not only within the county, but also cross county, cross region. So kind of what I hear is that we're all navigating a couple of shared tensions, lots of systems touching the same youth, but maybe in some disconnected ways, whether it's fiscally. So taking a look at this slide that's up, really visualizing some of that reality. There's a lot of overlap that exists across all of our systems. And let me be clear that this is just a snapshot of a few. There are many. There would be lots and lots and lots of circles. And there are other partners. Community-based organizations aren't reflected here. So there's lots of others, as well as the services that are up on the screen, right? But this is just a one tool. And this really, we've got behavioral health, we've got child welfare, we've got education, probation, managed care, regional centers. Nearly every one of them engages in screening, care coordination, and crisis response. Yet some of, at least in the group I was in, we talked about how sometimes those services can often remain siloed. So one of the core challenges with this is that overlap doesn't really equal coordination. And so as we briefly shared previously, that each of these own systems have their own mandates, their own eligibility, funding streams. And so without that real intentional shared protocol or joint staffing models, we really risk that fragmentation. But on the flip side, particularly Richard and others, we also talked about how these overlaps can be an asset. So it really creates multiple entry points to support our youth and families. And so we're really trying to be intentional to leverage this redundancy to really catch the kids before they fall through the cracks. So this is just, again, a tool to maybe use in your own settings and really ask yourself these questions. Are these systems talking to each other? Do they share data, staff even, and what fiscal strategy is leading them? Or are they really operating in parallel and just kind of hoping things align? So this is where cross-system fiscal and program planning becomes essential as we move from co-location to true integration. So this visual represents a common issue, and it's a system that looks healthy above the surface with visible programs and partnerships in place, but maybe underneath the funding routes are tangled and restricted. So we've got this root-bound plant, the visual on the left side of your screen. It's really constrained by the size of its container. And so think about whereas each funding stream is like a rigid wall of that pot. And so those walls help keep the system upright, but they also really prevent organic growth, flexibility, and true integration. And so these are some examples of some funding barriers, just as a resource possibly to take away. Joe mentioned it, but I want to reiterate that FFP requires precise matching and documentation. No match, no revenue. 4E is a really powerful but tightly scoped to eligibility for placement-related services. And then education, right, is still anchored to those academic objectives. We had a big discussion in our group about that different goals of each of these systems, and they don't, while there's overlap, they don't always align. The right side of your screen goes over some behavioral health constraints. These funds are not youth specific, and they often can't be shifted across buckets. There's really rigid service definitions and provider rules that limit adaptability. So even when counties have funding, it's not always flexible or aligned to meet the specific complex needs of these youth. Sometimes there's surplus in one bucket and a deficit in another, but you can't move the dollars. And so many of our advocacy bodies ask us in all systems, why are there underutilized funds when we still have these unmet needs? And our systems are really structured to compete for nutrients instead of really reinforcing one another. So as we move into conversations about braiding and blending and fiscal strategy, keep this image in mind that we're not just talking about more funding, but we're really talking about freeing the roots so we can sustain and scale what works. So continuing with this metaphor, here is another slide with some state level constraints and access issues. So on the left, we've got 91 and 2011 realignment funds, really based on historical formulas as a barrier. It's not based on need. These allocations are often already overburdened in counties, and they're tied up in these categorical restrictions. And if we see a spike in the needs of our youth, these dollars are not tied to that. They don't automatically adjust. There's also the state general fund, which is great. It's used to plug holes, but as we're seeing this year, it's politically sensitive, it's unpredictable. One bad budget year or a shift in policy can completely eliminate a program. On the right, we see system navigation and access issues, even where funding might technically exist. So we've got, for instance, under CalAIM, we've got the enhanced care management and community supports, super promising, even in action. But there's oftentimes some inconsistent implementation across managed care plans. So that can make them hard to access, and especially for the child and youth serving populations. And then at the bottom right-hand side, that TANF and CalWORKS, really many high need families sometimes don't meet eligibility because it's means tested. And then even more critical, as we try to keep families intact, non-parent caregivers like relatives are often left out entirely. So in summary, even when thanks, Monica, even when funding exists in theory, it's sometimes not accessible, stable, or scalable. So now let's switch into how we compare policy and program coordination with fiscal strategy. This slide now focuses on how we can begin breaking that planter, right? Let's not be walled in by our funding. But let's not blow it up, right? But let's make intentional collaborative moves that really let our fiscal roots grow and mingle together. And so these are just a couple of strategies, really thinking outside the box to creatively expand the scope of services, leverage restricted funding, kind of what Richard was mentioning in Contra Costa, really focusing on how do we maximize the revenues that we are able to draw down. Families First prevention services to support prevention and early intervention doesn't necessarily need to be restricted to just one of those systems of cares, but across. And then where possible, particularly I know some of the smaller counties already do this, they consider braiding funds across county lines. It's not really about blending money, it's really about blending strategy. And so that can then really align those goals if we're all focusing on the youth. How we get there can then align up. And then we can maximize windows of opportunity. Put this on there, but right now we may not have the same windows of opportunity that have been in recent years. So sometimes you get some high revenue years for like 2011 realignment, and that is when you really want to make investments in sustainable workforce or different programs. So the big takeaway though is we're not necessarily finding new dollars. It's about using what we have more intentionally so that the system grows around the needs of the child and not necessarily the constraints of the funding. And then lastly, some other strategies are really to just address those challenges head on. We really need to speak with a unified voice across systems. That includes legislative and regulatory change, right? We've got waivers. And really, what this series is about helping our decision makers at the county level understand the consequences, right? What does this shift? And really bring forward that data and stories that illustrate the inefficiencies, and then how we can move to shared resources and reduce waste. So we talked about redundancy. It's not really do more with less. It's really about doing better with what we already have by working smarter and together. And then that makes the system more nimble and more accountable to the child and not necessarily the bureaucracy. So next I'm going to launch into some 2 real world scenarios to really just kind of not talk about hypotheticals anymore and see how deeply interconnected our systems are when we serve youth with complex needs. So on the left-hand side, example 1, we've got an STRTP placement for a probation youth with behavioral health and educational needs. So this youth is going to get services from perhaps some specialty mental health services, maybe therapeutic behavioral services, TBS, crisis intervention. But then their STRTP is also going to provide their clinical support and medication management. Probation is still going to maintain the oversight, the risk assessment. They're still going to coordinate with the family, court. They're a key voice in reentry and stabilization planning. And then we've got education. The education liaison is going to support that youth IEP, help maintain school continuity. And then maybe the county behavioral health department, they're going to draw down Medi-Cal for that specialty mental health services that they're providing. And if a youth is enrolled in a managed care plan, they might also be eligible for ECM or community supports. So this is just one everyday example, and all of these systems are involved. And so one missed handoff can really derail care or result in lost reimbursement. On the right-hand side, we have another example of a regional center placement for a youth that is involved with child welfare who's duly diagnosed with autism and DMDD. So this youth is Lanterman eligible and receives case management, behavioral supports, residential placement via a POS. But then child welfare really holds the placement authority and drives case planning, working very closely with their regional center and school district. You may have an educational liaison that's going to support the IEP. And then you still have behavioral health. And if the managed care plan, if the youth is enrolled, to potentially fund some applied behavioral analysis. But I do want to point out that some youth are still in fee for service, and then the regional center may step in. But your county behavioral health might be called in for crisis or outpatient support. And then specific for youth involved in child welfare, you have a foster youth services coordinator that kind of liaison and makes with the IEP team. And, really just want to resonate that these are not hypothetical cases. These are the youth that we serve every day in our caseloads, in the classrooms, in your facilities. And it really takes us going beyond co-location and moving into that co-design and really share not only planning, accountability, and fiscal understanding. So I'm going to turn it over to Artie because even these best plans fall apart without aligned funding. So we really need to kind of understand how one department can't claim, then one plan can't bill, and how the whole system feels that ripple effect. So to walk us through that, go ahead, Artie.
Thank you, Melissa. As Melissa just shared, even when every system, probation, behavioral health, managed care, education, and child welfare is at the table, things can still fall apart if the funding behind the work doesn't align. So this next section shifts us from program coordination to fiscal alignment, because no matter how strong the collaboration is, the work isn't sustainable unless the dollars follow. Before we dive in, a quick heads up, we're going to a bit into the weeds, but we'll keep the focus on big picture ideas. We won't need to follow complex formulas, just pay attention to the conceptual impact of what happens when a staffing or program shift. This section is really about understanding cause and effect, how one decision can create fiscal consequences for the other departments. What this next set of slides will show is that how the structure of the county expense claim affects cost sharing, why even a small staffing or program changes can shift financial responsibilities, and why program and fiscal leads need to be aligned early to prevent surprises. These are not just budgeting details, they're operational and realities that affect sustainability. Next slide. To understand how staffing changes affect funding, we first need to look at how the CEC is organized. The CEC groups services into four main functions: CalWorks, other public welfare, child welfare services, and childcare. For this example, we're focusing on CalWorks and CWS. Picture each function having 4 staff. That means shared costs like rent, admin, support, IT are split 50-50. What we're trying to illustrate here is this: staffing levels directly determine how overhead is shared. When a department adds or shifts staff, it affects how each group pays forward services or shared services, even if the other departments don't change anything. Next slide. Now let's walk through a common scenario. A staff member from CWS moves into a CHW role that's funded outside of the CEC. That person is removed from the cost pool, and the overhead they were covering now has to be distributed. What this example highlights is that one staffing change can increase overhead cost for another department, like CalWorks, even if that department had no involvement in that decision. This can create friction or confusion, especially if those shifts aren't discussed upfront. It also raises the question of whether CHW funding stream is covering its fair share of the indirect cost. If not, the gap has to be filled by another county or another program. This example helps us see the importance of cross-department communication before changes are made, not after the impacts are felt. Now, instead of reassigning someone, imagine CWS simply hires an additional person. They go from 4 to 5 staff. CalWorks stays at 4. Now there are 9 total staff in the cost pool, and overhead gets divided differently. What this shows us, even though CalWorks didn't do anything, their share of the overhead cost decreases, while CWS takes on more because they've grown. That may sound like a straightforward adjustment, but it reinforces the bigger point. Staffing changes in one department automatically affect funding dynamics for others. And again, if these decisions aren't made in collaboration, they can result in misunderstanding or misalignment before budget discussions. In this scenario, we're not shifting or hiring within an existing department. We're adding a completely new CHW position funded outside the CEC. This new person becomes a 9th staff member, which slightly changed the distribution of overhead across all programs. What this scenario helps us understand, even though CalWorks and CWS staff counts didn't change, their overhead responsibility slightly decreases since the CHW is now picking up a portion. But, and this is the key, that only works if CHW funding source is designed to absorb its share of indirect cost. Otherwise, that savings for CalWorks and CWS is an illusion, because the county or another department still has to make up the difference. This kind of misalignment can quietly strain resources and relationship, especially if there's no shared understanding of how the math works behind the scenes. Across all these examples, the key message is this: small staffing or program changes have broader fiscal consequences, often in ways that are hard to see without stepping back. And that's why it's critical to bring fiscal voices in early, not after the fact. Now that we've covered how costs are shared, let's shift how those costs are actually claimed and reimbursed. Joe's going to walk through a practical example using especially mental health and show how understanding the mechanics of claiming is essential to making sure programs stay funded and sustainable. Joe?
Thanks, Artie. So this is a very high level, very basic example of just a specialty mental health claim. Making some assumptions here, we'll just assume 50% of the match is FFP and the other 50% coming out of realignment to pay for this service and the staff time here. So in our new world, it's not like we saw in the previous example of administrative costs and dividing that up. It's like we have to have a rate that covers these costs and the cost of the staff and keeps our services going. So in this basic example, using a county funded staff, it could be more complicated with contract providers as they would have the same scenario needed to cover their costs, but have a portion of the rate and from the county. So, but just keeping it simple, a county staff provides a service. It's if we put up that 50% realignment for the provided service, then the 50% FFP comes in and the client's served. So if for some reason that service isn't provided, all of that cost for the staff time would go to the realignment in this case. So that's just part of the nuance in trying to project out how revenue can help offset costs or preserve allocations, but also there could be some volatility in it when providing direct services. And I will hand this back. Is this back to?
It's back to me. I'm good. So we're kind of gearing up and coming to a close, but I really want to take a moment and just look at this image that's in front of you. We've talked a lot today about funding. We've talked a lot today about what's included on the fiscal side of the house and where things kind of go. And in fact, we heard a lot, even your last breakout session, about trust, about goals, about fiscal being at the table and mapping it and needing these things to be able to kind of really move projects forward. But let's stop for a moment and really think about what we're trying to do. This is what we're working towards, is this picture. So just look at it real quick. And it's about a stable and nurturing environment for families that can thrive. It's surrounded in supports that they need. The beauty in the picture isn't just the home itself, it's the garden. It's the relationship, the trust, and the system working all in the background to make these things possible. It reminds us of when the right conditions come together, strong programs, meaningful collaboration, and sustained trust makes families flourish. So when you look at the picture here, you see that happy family and you see the things that we're talking about. In many ways, we have to break the things and conditions in which we've done things in the past and really begin to look forward and try and find a way of moving our thoughts and moving the things that we have in front of us to a different space. Next slide. So now we can take a look at the inside of the home. The bouquet presents what happens when each of us bring a unique strength, perspective, or resource to the table. No single flower makes the whole arrangement, just like no one organization in the system can do the work alone. When we come together, bring all the tools, our insights, our relationships, we create something beautiful, balanced, and stronger than one part could be on its own. This is the power of collaboration, the power of relationships. It's not about giving up your identity. It's not about being something different. It's about contributing what we have to something that's greater than what we have today. And then again, we bring it back to relationship. And it's about coming full circle. And it really is that all the systems, all the fundings, all the strategy in the world won't get us where we need to go unless we commit to working together. It really is about together. If you think about the situations that we're in over the course of the last 10 years, we have had incomes coming in at a great pace. We've really seen different things come forward. Now we're in a new time. We're beginning to see the economy take a little bit of a clip. We're beginning to see things happen where our funding structures are becoming a little bit more fragile in the things that we're doing and the things that we're having to become reality. I truly believe that without relationships and without collaboration, I don't think we're going to get to that next space in time without working together. Real collaboration means breaking down the walls. We've created these walls, and Andrea talked about at the beginning, these silos. You all talked about it even in your breakout sessions, where we have silos, and these silos really do need to be broken down. And it's not about who owns what. It's about how those things that we have can better work together. And that really is creating these relationships. We have to stay grounded in trust, curiosity, and a shared belief that our children and families deserve more than isolated efforts. They deserve a united system that sees and supports them fully. And that can only happen when we continue to invest in each other. I really believe, and I challenge you all to really begin to think these things through and really try and figure out how these relationships, and we showed you earlier that you have them, can become part of your everyday structure. I'm going to turn this over to Andrea so we can have a quick breakout session and discuss the things that we kind of talked about today.
Great. Thank you so much, Robert. I think we'll move into the same format that we did. So go ahead and select your breakout room and we'll return to those for a good 10 minutes and then we'll come back and close.
Okay, well, I want to welcome everybody back and kind of take a moment. Why don't we have Andrea, why don't you go ahead and start on what you got out of the breakout session?
Okay, we had a great breakout session. In Central, we have probation and regional center and social services all. So we were also talking from our own purviews and some of the strategies or the ideas going back home. One of them was to, and this is one particular person said that she was going to start going to her ILT meeting all the time. It's kind of an opt-in, opt-out for her, but she's going to go. And the second person said that they were going to invite their fiscal to their 2083 team and just to run that up the hill and see if that would work, but everybody's fiscal to join the ILT and just sort of ask conversations. Like, what do they know about each other's fiscal landscape and just where are the opportunities, but to just start those conversations in a local system of care. And then one person said that the next session, the 101B, that she's going to invite her whole team. And that we were talking a little bit about marketing, that we should really kind of double down on the message that full system of care teams need to come to the next session as we go a little bit deeper into funding pathways and opportunities to grade and optimize. So I think we talked a little bit about just how to use this session because some of the folks said that what was helpful to them in the past were coming to 2083 convenings and things like that. So just to use this as a platform to continue that partnership. And, if everybody can come here together, that might jettison some conversation around fiscal collaboration post the next session.
Great. How about Corey? Can we hear from you?
Yep, certainly can. The Northern Group reconvened. Really great questions to look at as far as where we're going to take this work. I heard some really good things. First of all, there was a lot of sense of being encouraged that problems that feel like they're just our problems in our systems work is starting to feel like, wow, other people have that too. So there's a sense of camaraderie in this particular group, knowing that we're sharing in that. There was ideas around effective communication, the importance of having people together, maybe not so much online, but really convening in spaces together where as humans engaging to meet the needs of our high-risk youth, that we're doing that eyeball to eyeball. We got into some conversations around increasing our knowledge of these silos that do exist and doing so by bringing first one's own fiscal knowledge in the program that individual works in to sort of pass the olive branch to say, if I really want you to understand my funding processes and then encourage that from the other partners, which I thought was really beautifully said, because it does lead first and then know and trust that others can follow. We did talk a little bit about some of the barriers that come when you've got ego in the room, how important it is for us to acknowledge our own ego, see when it's getting in our own way, and really start whittling through that through meaningful connection. So thanks again to the Northern Group. Thank you for weighing in on that. And just to wrap up before I pass it on, really excited to see where some of these questions that are being posed can be addressed in the future sessions coming up. I'm just getting so excited that we can start to really delve in and make things really tangible from what this great fiscal group has sort of led with the last 2 days. So,
Laura, do you want to go?
Yeah, thanks. So I had the Southern group and just a couple of highlights from us. One of them actually mentioned, Robert, that in a session she was in with you yesterday in a breakout, that you encouraged really, because she's new in her position. So we talked about when you're newer, how to navigate, all these different partnerships, and that you really encouraged her to reach out in this day and age. It's so easy to make connections with folks. You have LinkedIn, you have social media, you have email, all of these things. And so she was really committed to, she invited someone to a meeting they have on Friday. So just really reaching out and trying to make those connections. And then we talked about using the key stakeholders and making sure that, every regional center has a system of care coordinators. The managed care plans have the child welfare liaisons now, how to reach out to them and make sure that they're at the table also. And so someone mentioned having a child welfare liaison at a consult earlier this week, and it just made such a difference. And so just making sure that we're continuing to reach out and have the right folks at the table.
Nice. And Richard, what about the Bay Area group?
Yeah, thanks, Roberto. Anna and Artie and I chatted about this essential question of like when do you bring fiscal budget expertise into the conversations? And while we have great respect for the idea that you could somehow deal with the bandwidth issues on a fiscal budget officer's calendar and invite them to a 2-hour ILT every month in some counties, that ain't going to happen. And so the workaround to that is making sure that the ILT is administratively supported to have clear minutes from their meeting. So ILT and EAC have minutes. They're posted in a shared place. And then you can just ping the fiscal folks and say, hey, there's a couple topics over here for your awareness. Do we want to talk further at this point, right? So minutes taking is a super important way. Artie talked about the fact that you got to have the right fiscal expert in these conversations. If you're too technical on the fiscal side, sometimes you'll get really well-intended accountants that know their jobs really well, but may not have the capacity to navigate the complexity at the kind of translating to vision. And so you'll get a lot of no's, like, no, you can't do that. No, you can't do that. So you got to have the right budgetary expertise at that interagency level. And then we talked a little bit about one of the things we did in Placer, which you mentioned yesterday, Roberto. You probably get to it again. It was just making sure you have a standing meeting between management, fiscal and program folks, like already on calendar, right? Because if you do it ad hoc, it often doesn't happen. But if you have a standing meeting where you can both go and say, this is what we're thinking programmatically, new program, new contract expansion, this is what we envision for our extra dough. And then the fiscal folks can say, well, there's not really that much extra dough, or the dough you have can't be used that way, right? Like you can have that conversation in a standing, regular, fixed way. You shut the gap, you close the gap internally within your own departments at least, right?
I think all this is great, and thank you all. I really want to go over some takeaways, but I really believe, that this relationship stuff is about where we're really having conversations that really matter. So Monica, if you can flip the slide and bring up the takeaways. So, and Richard just spoke to this again. It's really not just about creating relationships amongst system. It's creating also relationships internally to yourself to make sure that fiscal is in the room and having those conversations. I spend a lot of time to make sure that I know what programs know. I go to as many meetings as I possibly can so that I could better understand what's coming down the pike from a fiscal perspective countywide. I don't just want to be at the last minute asked a question, because then those answers are no. And Artie's completely correct. One of the things that I talk about all the time is that fiscal needs to get out of the realm of speaking fiscal language only. We all need to speak English on a constant basis to each other, and really need to make sure that the person on the other side is understanding, and program the same way with fiscal. Fiscal doesn't always understand what the program speak is and how that looks and how that works. I can give you a quick example of where, when I was in social services, someone came to me and said, we want to put this program together and it's prevention. And they said, but so we know we can't really fund it. And my comment was, what are you trying to do? And when they explained it to me, I said, if we change 3 words within what you're talking about, I can fund it with Title 4E, and that's all it takes. It's the idea that it doesn't, just because you see it as prevention doesn't mean it's prevention. How can I better align what's happening? And I just use that to give kind of the guidance that sometimes we not only have to get in the relationship, and we talked about trust earlier, and we talked about goals. If the goal is the same on both sides to help people, and I know it is because that's why we're doing government work, it's to help people. How do we get there? I think increasing your knowledge, whether you're on the fiscal side or whether you're on the program side of each other, which means talking and really beginning to understand what the information is and what the program is about and what the funding is about, is something that can happen. I used to sit down and we used to have quarterly meetings about things on a constant basis so that people better understood what the funding was about and I could better understand what was going on in program. Understand your county's landscape. Every county is a little bit different. And I will tell you, large counties, you can learn a lot from the small counties because they don't have the same funding resources that you have. They have no choice but to have relationships. And those relationships that they have are how they get by on a constant basis. They don't only do it within themselves, they do it within county, where one small county talks to another small county. That's why they have the 20 smalls, to really make sure that they better understand the things that are going on. We can learn a lot from that group because they have to do these things on a constant basis to make sure that the things are getting done. Just the day-to-day gets done. Be willing to adapt and find things. And again, I challenge you here. You're going to have things that are going to happen here in this very near future. The surroundings around us are changing, whether it be funding, whether it be program, whether it be just conversations and things that are happening. Everything is beginning to change, and we need to begin to change with it. We can't continue to say that what I did yesterday is going to have to be the same as it is today. We're going to have to break that mold. It really is important to get that type of stuff done. And then planning is huge, and you have to kind of begin to think through what the system of care is going to do for you and be willing to voice ideas. There is nothing wrong with voicing something that's out there. It's the way that we get things done. It really is about making change, and change can only happen if people actually voice their ideas about what's being done or how we might be able to willing to do things better, and then have the willingness to adapt to that change and make things through. I'm going to turn it over to Andrea. I really appreciate everyone's time. Andrea, it's all yours.
Yeah, sure. Well, thank you so much, Robert and Joe, Monica, Artie, and Melissa. Was a great first session, and you guys really made a case for collaboration on behalf of our shared children, youth, and families. We do hope our time today was helpful, mostly as a catalyst for conversation in your own local team. Our next session, 101B, and Peter will drop a flyer into that, but the next session, September 16th and 17th, it's 101A. We have 101A today. This is 101B. So it's the final kind of level setting conversation before we go a little bit deeper into some of our behavioral health education initiatives and like CYBHI and community schools. So we're going to get to model application right after 101B. But next session will be a deeper dive into the general funding streams for each of our 5 key systems. And again, from there, we're going to look at opportunities for us to maximize revenue. Please register for this next session and think about asking your entire team to come with you. And then finally, I think I've got you for one more minute. If we could just, there we go. So here's immediately what's available for you. If your county team, if you or your county team heard something today that you'd like to unpack a little bit further, we have the capacity to provide some great TA to your team just immediately following the session. So please take a look at the flyer in the chat if you haven't already done so, and don't hesitate to reach out. And then in the final moment that we have you, I'm wondering if you could complete this survey. We're going to drop it into chat. We want to know if we hit the mark, how we did today, and what you hope we will cover next. We will also, in case you are wondering, we're going to send the survey out in an email as well if you don't have time to do that right now, but we'll also send the PowerPoint, the recording, the TA flyer, the takeaway doc. We'll send that into an email by the end of the day. So you will have all that for you. And with that said, thank you for attending today, and we look forward to seeing you in September.